Good morning and happy Malaysia Day. Learning includes the acquisition of many domains, not just knowledge, but also skills, decision making, and attitudes. Learning is the process of acquiring new knowledge, relating it to what is already known, and developing new understanding. This is a complicated process. And what is training? Is our aim to impart all that we know on our trainees, or is it to help the learners help themselves? Knowing something about how adults learn will improve the trainees' engagement in their learning and training. It will also help you teach more effectively, and it will enhance our medical education objectives and curriculum planning. When we talk about adult learning theories, Malcolm Knowles is a well known figure. He died in 1997. He was an American educator and researcher. We need to know about Knowles' six core assumptions, the four principles of teaching adults, weakness of these adult learning theories, and other learning theories that are available for healthcare professionals. There are certain assumptions that we make towards this learner or trainee. So we assume that they have a sense of self. They are self-directed. They want ownership over their learning. We also assume that they bring a wealth of life and work experiences. We also assume that their readiness to learn depends on whether the topics that we bring up are relevant to their lives. So they're constantly asking themselves, why do I need to know this? Compared to children who just accept everything that you teach them. Adult learners also have a certain orientation to learning, which is problem centered, not content centered. So what they want to know is, will this learning help me deal with a situation which I find myself in? Another aspect or assumption about adult learners is that they have internal motivation rather than external motivation. And also, we assume that the learners want to understand why they should learn something. So they would be thinking, I need to learn because my circumstances are changing. So these are some of the assumptions we have about adult learners. Are they always true? How children learn, it tends to be passive, dependent, and teacher led. On the other hand, when it comes to adults need to be involved in the planning and evaluation of their instructions. Experience, including mistakes, provide the basis for their learning. And their learning tends to be problem centered. And they're most interested in learning something that has relevance and impact in their jobs and their personal lives. What are the limitations of these adult learning theories? Well, it gives an idealized view of the trainee as a self-directed learner. And we all know that we have trainees who sometimes struggle. They need a mentor or a person to light the way. There are some trainees who need a firm hand and would prefer guidance and structure. And sometimes this self-directed learning may not be suitable in a culture that traditionally values respect for elders and teachers. But most importantly, can experience and mistake form a basis for learning when patient safety is affected? This is the Miller's pyramid. Okay, this pyramid is important because it's not just about imparting knowledge, it's about training students for the healthcare profession and remembering that the outcome of training is intended to be a graduate who can take their place in the workforce. They can go to the regional state hospitals and work independently. So while knowledge is the foundation of the pyramid, it is not the entire pyramid itself. There is another type of aspect to learning, which is called the Johari window. There are so many types of knowledge known to self, known to others, not known to us or to others. The only way that we're going to find out what we don't know is by discussion between individuals, because that will increase the amount of practical knowledge. And some things will always remain a mystery until we talk to someone else with a different range of knowledge or understanding. So it follows that instead of having an echo chamber where you have similar people from a similar background saying the same things to each other until it becomes the truth, you should have a diverse group membership. And these students should be encouraged to discuss cases with each other so that knowledge is more balanced and well-rounded, and there is critical thinking. How do we apply everything that we have learned in a formal and an informal setting? to determine a trainee's internal motivation would be, apart from an exam and an interview, a personal narrative essay could be an entry requirement. It'll give us an idea of the trainee's background, how they communicate, what is their motivation, and what they intend to do when they finish their training. Scaffolding refers to structural things such as the syllabus, lectures, reading lists, learning outcomes are provided by the teacher to guide the learners through teaching and learning material. And we're already doing some of it. For instance, my URC has initiated an orientation course for new trainees. Maybe we should have a training program director at each hospital who will be able to give an orientation to new trainees who come and join their department. And this orientation can also be given during the annual Malaysian Board of Urology evaluation. The Johari window pointed out that learner does things with knowledge. Learning outcomes should be actions rather than list of things to learn. For instance, we want a candidate who's able to manage hematuria rather than knowledge about hematuria. Our curriculum is long due for a review, and maybe at this time it should include non-technical skills such as importance of clinical reasoning, higher order thinking, and surgical ethics. Because once again, the outcome of the training is to produce a graduate who their place in the workforce, and providing knowledge alone may not be adequate. Our urology courses and conferences can be problem-centered rather than content-centered. Some learners prefer to work towards a deep understanding of what they are learning. I'm one of them. And there are others who prefer to acquire the facts, a term known as surface learning. So as a trainer, your job is to identify who your trainee is and to ensure that the deep learner does not get bogged down with irrelevant details, while the surface learner is encouraged to get more depth. So one of the ways would be to provide clinical context in their learning, teaching at the bedside, using patient scenarios, thinking aloud how you make decisions, case-based discussions, role play, and simulation are all aspects to this type of learning. Another important aspect is to provide feedback and encourage your trainees to self-assess and reflect. Progressive responsibility means that students initially come with a dual thinking where they have a clear view that you as their trainer will tell them the difference between right and wrong. And eventually, as they go through training, they realize that context is important and they, their colleagues, and the environment are valuable sources of knowledge and experience. There are many gray areas in urology, and with this change in focus and understanding, there will be greater confidence in your trainee in coping with uncertainty. When there is a complication, encourage a reflective practice, either by journaling or during the mortality and morbidity discussion, or debrief after a negative event. We tend to go to meetings and discussions expecting to gain new knowledge. A flipped classroom refers to the where read before you go for a teaching session, so that the teaching session is to provide clarification, to ask questions, and to have discussion. What are the challenges to implementing adult learning theories in day-to-day practice? First is the time pressure. We're always understaffed and service takes a priority, and there is usually very little time during your day-to-day work life. And then, of course, we face trainees with variable motivation and readiness. The expectancy valence theory, where a person's motivation to learn is determined by whether they expect to succeed and what is the value of the success to them. And then, of course, we all know that as we grow older, it is more difficult to acquire new knowledge because there is less brain neuroplasticity, there is lack of time, there's self-doubt, there are financial barriers because you have a family to support, and often there is lack of support, especially if your spouse is not committed to this long process of learning. So what are the take-home thoughts of this presentation? Well, the first is that adults learn best when learning is relevant, problem-based, and self-directed. The trainer is not a knowledge provider, but a facilitator who helps the trainee learn how to learn. And a dynamic training program and curriculum will constantly revise itself and revise the way it teaches. And if you still are unable to find any motivation to teach your trainees, remember that the person who learns the most in any classroom is the teacher. Greek philosophers like Aristotle, who taught Alexander the Great, says that teaching is the highest form of understanding. So remember that if you teach, you would find that your own understanding of a particular subject improves. I conclude this presentation, and I hope to see you at the Train the Trainers course in October.